Welcome in the Medical Museum, a place where we have artifacts from the past and modern times. And behind me there is a new piece of work. It is called Femme Fatale from the British group Pharmacopoeia. And these artists are interested in the same thing as you and us, and these are described in this MOOC. It is about people in modern environments becoming obese, hypertensive, diabetic, and also with high levels of cholesterolemia. And you know how it ends, because then you have become a patient and you end up in the doctor's surgery, whether it's a GP or in the hospital. And when you go in, the talking starts, and when you come out, you are dressed in emperor clothes. It is like a robe, a new robe that you can wear for the rest of your life.
And if you would look closely at this robe, you would see that it's composed of the 27,774 tablets, pills that doctors prescribe to patients with the metabolic syndrome. And the artists have looked at actual patient files of a woman from the UK and a woman from Denmark. And this is what an average patient with the metabolic syndrome takes in 10 years. This is how doctors treat metabolic syndrome, how they treat the consequences of the mismatch of our genes and our modern environment.
You can ask me, and I can ask myself today, whether that's correct. I have been prescribing these drugs for 30 years. I have given so many people such a nice emperor cloak. The answer to that is yes, it's good. Because we know that the outcome of patients with metabolic syndrome is better if we prescribe all these tablets. The other question is whether you could ask, and you can ask me, is it sufficient? And that is a little bit sobering. And now when I'm looking backwards, I can admit that probably I didn't pay enough attention to the prevention of the whole thing. I didn't do enough to get the people lean and on the move again. Because if we don't address the root cause, we keep on prescribing all these tablets.
In the first step of this MOOC, we've seen how the environment makes us ill. How our old genes are not fit for this environment. And in this step we're going to look at how the current medical system deals with the consequences. How in a medical reflex they prescribe all these types of drugs. But we're also going to look at some common age-related diseases and some alternatives to this medical reflex.